Come in.
Good morning. My name's Kara. I'm going to be your nurse for
Hi.
today. Congratulations.
Thank you.
How are things going?
Pretty good. I do have some questions though about breastfeeding. I have HIV. Am I allowed to breastfeed with that?
So that's an understandable concern. We typically recommend that you breastfeed, but with HIV, we typically try to avoid it.
Okay.
But there are ways to get around that. Are you prescribed or taking any antivirals?
So I do have them at home. Sometimes I forget to take them, but I try really hard to.
Alright, so it's recommended that you take the medication as prescribed on a daily regimen. That will help prevent any transmission from mom to baby.
Okay.
So we want to get you on a stricter regimen, and also the baby will be taking antivirals for the first few weeks.
Oh, okay. So what if my viral load is really low?
If your viral load's low, that typically means that the transmission rate from mom to baby is low as well.
Okay.
So another thing that we worry about is HIV can be passed through the blood. So
Okay.
we worry that while breastfeeding, if you have cracked nipples, it could pass on to baby. We do have some creams that will help prevent that.
Okay, well that's great to know. I'm really excited about breastfeeding, so I'll make any changes that are needed so that we can do this for the sake of the baby and myself.
Alright, great. I'll go step out and get you some information that you can take home.
Can you believe a mom with HIV is even considering breastfeeding her baby?
Honestly, I can't. Doesn't she know how dangerous that is?
Excuse me, I prefer if you don't talk about our patient like that and keep your opinions to yourself. Our job is supposed to provide education so that way our patients can make the best decisions. We're supposed to be advocates for our patients, not judging them.
Sorry.
Alright, I brought you some information on breastfeeding
Okay.
for the first few weeks. We could go over it together.
Okay, that'd be great.
So first recommendation is if you do choose to breastfeed, we recommend doing exclusively for 6 months. That means just breastfeeding
Okay.
for 6 months and even up to a year.
Okay.
While breastfeeding, it's important that you and baby take antiviral therapy to reduce the chance of transmission.
Okay, so what if I become sick while breastfeeding? Is that a problem?
So if you become sick, our recommendation to you is to limit exposure. So try to avoid crowds as much as possible and try washing your hands as much as possible.
Okay, great. Are these medications dangerous to the baby?
So research has shown that it doesn't affect baby, it doesn't cause birth defects while in the womb, and no side effects. Typically the baby will receive this for the first 4 to 6 weeks after delivery.
Okay, well that's great. Thank you so much. I feel so much better about breastfeeding and I'm much more informed.
You're very welcome. We're here to support you and you can call us anytime.
Thank you.